Hi, this is Dr. Mohammed Tauseef, consultant physician and diabetologist practicing at Medicare Health Center, Bangalore. As we all know that the prevalence of hypertension has been increasing day by day. And our topic of today's discussion is to understand what is blood pressure, what is high blood pressure, and the ways to prevent it. So it is very imperative that we understand high blood pressure. It has always been designated as a silent killer, and because due to various reasons, because many of the patients who suffer from hypertension do not develop any serious symptoms, as a result of which it could lead to serious complications such as heart failure, kidney failure, sudden cardiac death, eye damage, and blindness. So what is normal blood pressure? Before proceeding, let me explain to you what is blood pressure. Whenever your heart beats, it pumps blood inside the blood vessels that exerts pressure over the walls, and this is called as blood pressure. A normal blood pressure is between 120 over 80 millimeters of mercury. So 120 refers to the systolic blood pressure, which develops whenever the heart pumps blood into the blood vessel, and 80 refers to the diastolic blood pressure, which refers to the pressure that develops whenever the heart relaxes in between the beats. Due to various reasons, if the blood pressure remains persistently elevated beyond 140 over 90 millimeters of mercury, that person is designated to be having high blood pressure. Many of the patients do not face any symptoms. Few patients do develop some sort of symptoms such as chest pain, headache, lightheadedness, early morning headache, fatigue, and dizziness, and as well as buzzing in the ears. And whenever you face any such symptoms, I would recommend you to see your doctor to get your blood pressure evaluated. So, what are the risk factors that will cause developing high blood pressure, that is hypertension? These are basically divided into the non-modifiable risk factors as well as modifiable risk factors. The modifiable risk factors are those such as age, because as the age advances, there is some amount of stiffness that develops inside the blood vessels that could raise the blood pressure. And the secondly being a strong family history and genetic factors, as well as the environmental factors. If any person has a first degree relative, such as a father or a mother, a sister or a brother, who is already having hypertension and taking medications, and that person is at high risk of developing hypertension in future. Coming to the modifiable risk factors, it could include sedentary lifestyle, increased consumption of salt intake, or being overweight or obese, lack of physical activity, increased alcohol consumption, high consumption of processed and salty and fatty foods, as well as stress and anxiety. So, hypertension is a easily diagnosable and easily preventable disorder, because it can be easily prevented by following and adhering to certain lifestyle measures, such as exercising and walking regularly, swimming and jogging for at least 30 to 40 minutes per day, 5 days in a week, limiting salt intake to less than 2.3 grams per day, limiting alcohol consumption, quitting smoking, avoiding stress and anxiety by following measures that would soothe and calm your mind, as well as having an uninterrupted sleep for at least 7 to 8 hours per day. And of course, taking medications regularly and adherence to the lifestyle modifications will help you prevent developing hypertension, as well as keep your blood pressure under very good control. So friends, I would recommend you to see your doctor on a regular basis, take your medications regularly, follow all the lifestyle measures which I just alluded to, and take care of your health. Always stay healthy, and thank you for your patient listening.